I usually cheat and have log in on my phone under another account just so that I can see what everyone is seeing and make sure that my mouse isn't going like all over the place. But today I decided, we're gonna wing it. So, good morning. My name is Miranda Stiers. My pronouns are they, them, theirs, and I am the Capacity Building Program Specialist for the California Partnership to End Domestic Violence. And I am really grateful that you all are here. I know most folks are working from home or whatever remote site is going to be safest for your organization. So welcome. I want to go ahead and have my co-hosts introduce themselves.
Buenos dias, everyone. I'm Alejandra Aguilar, leading the statewide prevention program at the partnership. I'm so excited to see faces and names. Just really, really looking forward to this conversation about how we adapt our prevention program. COVID-19.
Yeah, so we also want to hear from you. Where are you calling from? Where are you at? A couple of things just on our basics. You can expand your audio for call-in information. So if you are on your computer and start losing audio, if it's getting funky, or if you've called in and you're hearing a really horrible feedback, that means that you've got both your computer audio and your phone audio on, so please pick one. Otherwise, it's going to be really difficult to hear. And you have the choice on video. I know it says video can be disabled, so if folks are like, I got to click off real quick, you are welcome to do so. If you have to suddenly mute because there's some wackiness happening at home, that is not a problem. If you want to see who the participants are, you can click on participants and see everyone who is here. We also have a wonderful chat feature that I see some folks are already utilizing, which is wonderful. And folks are welcome to unmute as we really want to have a discussion with all of you. I would love to say, hey, we have all of the answers, and that's not real. So we want to hear what are folks doing, what's been working, what are some strategies. And we're going to be going through all of that today. It looks like we have about 75 people, which is awesome. And we have folks in all different positions, which I am incredibly excited about. We have agency leadership, coalition members, we have folks from a variety of fields, and a lot of individuals who are joining as well, wanting to learn more about how to do prevention in our current climate. Is there anyone else from the partnership who would like to introduce themselves before we get going? Not to put you all on the spot.
Hey there, this is Jessica Merrill. I do communications for the partnership. I just wanted to say hi and thank everyone for being here. And if you ever need any support with social or traditional media advocacy, I'm here for you. I will add my email in the chat. Thank you.
Perfect. And I love that we already have folks checking in the chat, because that is next. Whether it's in chat or unmuting yourself. So we've got our opening circle for folks who have been here before. I recognize who has, because I've got the chat going with where folks are calling in from. We're going to have a lot of time for questions and answers and being able to share some of your expertise, talking about what some of those emerging issues are that are coming up, and those challenges and triumphs, and sometimes our fabulous flops, and trying to figure out where we all land. So for our opening circle, if folks can please type in your name, agency, or location, or if you want to unmute and introduce, that is fine too. And I see we have folks from all over the state checking in.
Does anyone want to be super brave this morning and introduce themselves out loud?
Hi everyone, my name is Olivia. I work with Stand Strong, which is an agency to address domestic violence and support survivors on the Central Coast. And I am a prevention coordinator there. So, hello.
Hello.
Great to hear you.
Thank you. Great to be here.
I can go. I typed in the chat, but I'm also from San Luis Obispo. My name is Janae Sargent. I use she, her pronouns, and I work at RISE.
Welcome.
Yay! Thanks, Janae.
I'll go next. Hi everyone, my name is Billy. I'm a program specialist for the Coaching Boys into Men program, and I'm with Interface Children and Family Services, and we're located in Ventura County.
Welcome.
Thank you. Keep it going, folks. Keep it going. Who's on here?
Hi, everyone. My name is Sheridan Riolo. I work for the One Love Foundation as an engagement coordinator. My job is based in the Bay Area, but we do work throughout the country and throughout all of California. Happy to be here.
Yay! It's great to see your face.
Hi, everybody. I'm Judy Gordon. I'm with Rainbow Services in San Pedro. I'm the Community Engagement Coordinator there as well.
I can go as well. I'm Sabrina Hughes. I'm a prevention coordinator with Waymakers in Orange County. And I mostly wanted to hop on because I saw Billy and you were at Building Change Together. And I just want to say, what a wild first month of work for you, buddy.
I know, yeah. The first week I had the training, and then the second week we actually had someone leave Interface, helping cover and learn that. And then the third week we pretty much had to get it out of the office. So yeah.
Oh, all right. So yeah, just wanted to pop on and say that. Welcome. I'm glad you're here.
Thank you. Good to see you again.
This is Caroline from Mariposa, California. She, her pronouns. I work for the Alliance for Community Transformations, currently as the Youth Programs Director. And we work on the Delta Impact Project, implementing shifting boundaries. We're currently hiring for a program specialist in our community. And then we also work with Waymakers. So I just wanted to jump on and say our youth center has been partnering with you all in social media campaigns and talking about youth and healthy relationships. And we appreciate all the partnerships and are excited to be here today.
Great to hear your voice, Caroline. Thank you for joining us this morning.
Hi, and I would like to introduce myself. My name is Elizabeth Sanchez, and I'm with the Women's Center Youth and Family Services in Stockton.
Woo!
Welcome.
Hello, I'm Laura Morales. I'm from the Coalition for Family Harmony. I'm currently supervising the Emergency Domestic Violence Shelter, also in Ventura County.
Thanks for joining us.
Welcome.
Buenos dias. This is Cindy Marroquin. I'm with Rape Trauma Services in Burlingame, and I'm the Director of Education and Outreach and Programa para Latinos.
Buenos dias. Great to see you here.
Buenos dias. You too. Thank you.
I guess I can go to, hi everyone, my name is Sunny Kim. I'm from Korean American Family Services and I am a program manager.
Hi, Sunny.
Hello, my name is Omar. I'm from Strength United here in Northridge. I'm a prevention education specialist, and yeah, happy to be here.
Thanks for being here.
Hi, I'm Samantha. I'm also from Strength United, prevention education specialist and community organizer.
Hi, this is Janine Barbado from the California Department of Public Health.
Janine, thanks for joining us.
I just got back in. I got completely locked out, so now I'm just using my iPhone.
Well, I'm glad you're here.
Yeah.
Hi, my name's Kendall. I'm a prevention programs coordinator at RISE in San Luis Obispo.
Yay! RISE representing. Way to go, folks.
Hello, I'm Dalia from Monarch Services in Santa Cruz County, and I am a prevention specialist.
Great to see you.
Hi, I'm Janisa. I'm from STAN, Family Free of Violence, Contra Costa County, and I'm happy to be here.
Welcome.
Woohoo! Thanks for being here.
I guess I can go. My name is Ray, he, him pronouns. I'm from YWCA Silicon Valley as a prevention specialist in the Santa Clara County.
Thanks for joining us, Ray.
Appreciate it.
Good morning, this is Jen Torres, Center for a Nonviolent Community. I'm a community educator in Sonora, California.
Welcome.
Thanks for joining us.
Buenos dias, this is Laura Sunday from Center for a Nonviolent Community. Hola.
Buenos dias, thanks for being here. Thanks for inviting the whole team. It's so cool to see you all here.
Have to admit, I was geeking out a little as I was looking at registration and seeing how many folks were joining from different orgs and folks that I email all the time, and I get to see your faces finally, which is exciting.
This is so cool. I have so many ideas that are coming up for me of like, what can we do right now? So jot those down. I've got my notepad. I'm jotting down ideas like, ooh, as I'm seeing folks. Yes. So yes, let's share ideas today. Who else wants to say hello?
Hey everyone, I'm Holly. I use she, her pronouns, prevention coordinator, also from RISE in San Luis Obispo.
Way to go, team.
Hi, I'm Jennifer McMartin. I'm the prevention specialist at Cal Poly State University in San Luis Obispo. Many other higher ed folks.
Thanks for joining us, Jennifer.
Hi, I'm Arthi, also from RISE in San Luis Obispo. I use she, her pronouns.
Thanks for joining us.
Hi, I'm Caitlin Robbins. I am a community educator at Center for a Nonviolent Community in Sonora, California.
Hey everyone, my name is Nicole Zarati, she, her pronouns for Waymakers in Orange County.
Yes.
It's Virginia from Futures. This is one of my dogs, Brody, which is why I have to stay on mute because my two dogs are so excited every time someone walks by our house, which is a lot since everyone's working from home these days. But I will just share quickly that the CDC is really interested in hearing from the field about what folks are doing to still center prevention during this time. So this call is like at exactly the right time, and I'm super excited to learn from you all and share different resources and ideas that you have, and of course giving you credit, letting you know what you're all doing.
Thanks for joining us this morning, Virginia.
I'll introduce myself too. I'm Janae. I'm from the YWCA Silicon Valley and super excited to be here. I am also a prevention specialist.
Woohoo! Thanks, Janae. Who's next?
Hi, good morning, everyone. This is Melissa Espinosa, she, her pronouns. I'm from Save Alternatives to Violent Environments in Fremont. I'm the Youth Services Program Manager.
Hi, I'm Jenny. I'm with Center for Nonviolent Community. I'm a Community Services Coordinator for at least one more week.
Thanks for being here.
Hey all, I'm going to introduce myself. My name is Anna Gonzalez. I'm a Prevention Program Specialist for Community Solutions.
Welcome.
Great to have you here.
Hi, and my name is Heidi Acosta. I also work for Community Solutions as a Prevention Case Manager.
Hello, Heidi. Great to see you this morning.
Thank you.
Hi, I'm Pam. I work at Center for a Nonviolent Community in Sonora, and this is my coworker, Kylo.
Good morning, Pam. Great to see you. Anyone else?
Hi, this is Sabrina Van Zuden, she, her, hers. I'm a prevention and community engagement specialist with Center for Community Solutions in San Diego. Happy to be here.
Hi, Sabrina. Good to have you here.
Hi, good morning. This is Emily Velez. I'm the Director of Safe Haven Programs here at Humble Domestic Violence Services. This is my second week, so I haven't joined these calls before, so I'm excited to hear what people are strategizing.
Welcome. That is so cool. Oh my goodness. I see we've got, I mean, it says 94 preventionists on this call. Way to show up. Way to show up. I love this. It fills my heart with joy that we are all here supporting one another. That's what PPN is about. Prevention Peer Network. It's about a network of preventionists helping each other out, figuring out creatively, how do we get through this crisis? Beautiful. Thank you all folks for showing up. Thank you for being here. Give yourself huge kudos.
Your audio is cutting out, Alejandra.
Well, that's not good. Just huge kudos for being here while I connect through my phone.
All right. So excited to have everyone here. And Virginia, thank you for looking up that the CDC is wanting to hear from folks. We know that Cal OES is also really wanting, so that's California Office of Emergency Services, is really wanting to hear from folks what the needs are in the field, how folks are doing, how are you continuing your work, and how can they support folks. So really excited to be able to gather some of that information and hearing back from folks, and have so many people from literally all across the state, which is just fantastic. Great. So really just wanted to start with how are folks doing? Thank you for welcoming us into your home, by the way. This is my lovely space. I keep reading that you shouldn't have a workplace in an open area. I'm like, yeah, and short of kicking somebody out of the room, it's not happening. So we'll definitely be patient with that. But how are folks doing in your areas? What is this looking like for you as you're looking at your plans and how you've been doing your prevention? What is that looking like right now?
Hi, so I'm a youth organizer. I do the close to home model, and so a lot of the past week has just been planning to see how I'm going to be able to meet with my kids through Zoom, even if they want to. I know this is a really stressful time, especially for students, just adjusting to working from home and just starting to live their lives a little bit differently. So it's looking more so just like kind of weekly check-ins, self-care kind of calls, and then trying to see how we can continue our model like through online platforms.
Thank you.
And to help minimize some of the background noise, if folks can mute when you're not talking and then just unmute when you want to share, that'll really help us to be able to hear everybody.
Miranda, are you using the PowerPoint, or could we just open up to see?
Let's just open up.
Names, people. Yeah.
There we go.
So we know that some folks have had, some engaged conversations with their teams, looking at how are they adapting the conversation, how are they adapting their prevention programs. We have some folks here representing funders as well, right? Most of us have work plans, milestones, deliverables with dates attached to them. And we've heard from pretty much most of the funders that there's going to be some flexibility. There's going to be room for all of us to, you know, make some adaptations. But I think it would help to hear from a couple of folks on what is that looking like for you all, right? Some specific conversations of the adaptations taking place. We can start there. We can also talk also about, you know, there's a lot going on in the agencies, and you know, folks are having to respond to the crisis either at shelters, at the clinic. How is that impacting you all?
Sorry, one more request. If folks can please mute themselves if you're not actively talking. We're just hearing a lot of background noise.
Are you able to mute everyone, Miranda?
Yeah, I'm going to go ahead and mute everyone. So let's do that. And folks can unmute themselves as they go. There we go.
I can share a little bit in response to what you were all asking. I think right now for us, so when this first happened, not that it's been very long, but in some ways it feels like it's been a lifetime. I think our team was just sprinting, trying to do something, anything, and then we kind of took a second to pause and ask that question of, are we here to meet our grant objectives, or are we here to serve the community? So we've been spending a lot of time asking people, asking our community organizers, asking our volunteers, asking our social media followings what they need right now, and focusing on that and asking what programs we have that can and should be put on pause, and what should we be devoting energy to right now. So I think what everyone, at least what we're hearing, people are just looking for connection in any way. So how can we foster virtual connection to bolster that community connection and community care? So a lot of the virtual events, we're looking at hosting virtual events. They're not in line at all with what we were planning 3 weeks ago. And in some ways, I think that feels disheartening, but in others, it feels creative and energizing, I guess. It's just a really big turn. But I know I forgot, when this first happened, I forgot to ask people what they needed. I just thought, how can we keep our programs that we had going? And I think that that was a mistake. So taking the time to pause and ask is what we're focusing on.
I love that.
That's Can you hear me, folks?
Yes.
Okay, thank you. Would you mind, Janae, if I ask a little more? I love what you shared, and I love the asking the question of what do you need? I think, you know, Miranda and I talk a lot about preventionists are like chameleons. We jump into any situation and we adapt, we evolve, we blend into whatever is happening, and we just get the work done. And I love the feeling of disheartening, because it can be disheartening that so many of you had events planned. So many of you had gatherings planned, and, you know, just big badass efforts that were going to be taking place that you had an idea for, and that had to be canceled. And the canceling something that you have put so much work into can be disheartening. So how are you all, how are you taking care of that first? Because we've got to practice self-care as well. And it can hurt to have an event like that or a situation like that canceled. I see heads nodding. I see some folks that were like, yes. So what is that feeling for you? What are you doing with that? What do we do?
Yeah, I can talk a little bit more about that. I also work with our close to home program, and we right now are in the middle of the talk phase. So we had a lot of community conversations scheduled to talk to, you know, our community members and kind of spread the word on the results from our community survey. And not most of them, all of them were canceled. But the one that really, I think, hurt us the most is that we had a presentation scheduled for the city council meeting, City of Gilroy council meeting, and volunteers were going to take part in that. They were going to talk about our community assessment, what we found, what the problems we identified during that community assessment, and they canceled that meeting. It was going to be at 6 o'clock that day, and they called us in the morning just to let us know that it was canceled until further notice. So, and just like that, all the meetings that we had scheduled got canceled, and now we are trying to find ways to, get the word out into the community that we are willing to do this like online, via Zoom or Google Hangouts, whatever works for them. And we're planning that now, getting the word out. We send the link out, and we are hoping that the people are willing to join us for these conversations, because it's a very important part of our talk phase. So we're crossing our fingers that it works.
Thank you.
I actually want to share a bit of gratitude. We were very, very fortunate that I'm Pam from Center for a Nonviolent Community. I should introduce myself, I suppose. We had one of our largest fundraisers of the year was our International Women's Day fundraiser, which was right at the beginning of March. And I'm talking like months worth of work honoring women and young girls in our community. And it was the very last thing that we were significantly able to do before this happened. And so I'm really grateful that all that work was able to come to fruition, but also that is kind of not the last impression our community is going to have of us, but that we really were able to go into this on a really high note, and creating a lot of good connection and positivity toward our work as we go into this. So I know not everyone's experiencing that. I know some people have a lot of mourning and a lot of disappointment, but I just wanted to share some gratitude that if we were going to get put in this position, that was when we did.
Thank you.
And I would like to share, just like kind of on the flip side of that, I work with Pam at Center for a Nonviolent Community. And the program I've been working on is a grant through our local behavioral health system. And we were going to implement an 8-week program called Resilience for Youth at one particular school to 3 different grade levels. And we've spent, months and months preparing for it and building relationships. And we did 1 week of it and got to know the kids really well so far. And then we had to cancel everything. So one thing we're trying to do is to set up an Instagram account and connect with a lot of the youth that we've been working with, and post things that are relevant to our program, and maybe in the future make videos of our presentations and share it onto YouTube or on like Instagram Live or stuff like that.
That's a great point. I know we've had folks asking about social media. I know I received some Instagram messages and emails on, if we haven't had one before, now is the time to create one. Are there any guidelines or are there any recommendations on how to, develop an Instagram account or a social media platform focused for youth or for the community that you were working on for prevention? So I know that with Jess, our communications manager, we've been talking about hosting a conversation around what does that look like, right? And bringing in some experts. Pam from Berkeley Media Studies Group is on board to join us in a conversation around social media and how do you respond, and what is your message? What are the values that you're going to be focusing on in your account? So if that is something that you are all interested in, if you wouldn't mind also just putting it into the chat, what's coming up for you in terms of social media, communications, your messaging, how is that being developed right now? And you can also share out loud what are some of the needs that are coming up for you, or how are you making some of those adjustments right now, so that we can hear from you and be able to respond in a timely manner.
Hello. So in our social media account, we're really trying to plug all the information that's available now to the community. For example, at least in the San Fernando Valley, there's a lot of supermarkets that are opening early to seniors and at-risk populations. So getting that information out, we still have a 24-hour hotline that advocates are still answering the phone to help them out. And we do still offer some services. Many of them had to be closed down, of course, or suspended for now, but just getting out the information that is still available, the resources that are still happening, and also like a lot of self-care stuff about that it's okay to feel a certain type of way because of what's happening. You're not alone, right? Just reaffirming everyone in their feelings, and just giving them tips on how to like feel, get some distance away from family members that maybe they have, they don't get along with them very well, right? So just giving small tips like that. And yeah, trying to post consistently. And yeah, I think that's one of the best methods, right? Posting consistently and just not, I feel like people already get enough information about what's happening about COVID. So we're not really feeding into that. Everyone can already get information. What we are offering is the other side of things, right? The positives, if you will.
That's a great example, Omar. I think that, you know, I was chatting with folks about the prevention during a crisis, right? And how does it show up in our social media posts? And you just spoke about boundaries. We are in our homes with family members or roommates, or, you know, whoever is in your home, and you are in it 24/7, and we can all start getting on each other's nerves. So how do you set boundaries? How do you let someone know that, like, I need some space, or, you know what, I'm going to be working during this time? We're hearing from partners also who are saying, I'm meeting, you know, if my partner is on the call, and I saw it on Twitter that they were saying, I'm married to the circling back Joe. Like, that's annoying. That gets on my nerves. Like, I can't believe that my partner is the circling back to what we were discussing earlier. Like, we're hearing and seeing a different side of our partners right now through all of this time. So what messages can we put out there through social media and through different spaces that help folks learn or practice healthy conflict resolution, healthy boundary setting, stress management? So what are you folks doing for that?
I can.
Hey, oh, I'm sorry.
No, go ahead.
I'm Annie Olea from SAVE. I'm the Housing First Manager, and I normally hold 3 workshops a month for our clients. Our social media pages are kind of running. Our Facebook page and our Instagram pages are kind of just sharing resources that are coming up in the community for everyone to kind of be aware of. And my messages, because I'm not holding actual workshops, what I started doing probably about a week and a half ago now was actually sending out emails to all of my clients that kind of just share information, giving resources, talking about how important self-care is right now, sending videos and activities for the kids. A lot of our folks are home with their kids right now and are unable to work, and our clients are already anxious and they're already in that mode of feeling stress. And so kind of using this time to really be able to say, hey, like, I understand, because you know what, I'm feeling some of those things too. I may be working, I still may have a job, but I'm still home just like everybody else, and I'm dealing with the same kind of issues everyone else is. And let's talk about this. And opening it up, like asking them a question every time that I send an email saying, like, this is our question of the day, let me know, this is a check-in, how's everyone doing? And actually having a really good response from folks about getting back to me about like, oh, my kids are driving me crazy, or I don't know how I'm going to have food for the rest of the month, or whatever that is, and then being able to address those issues. We're all working remotely. We're all from home. And so all of our services, I can thankfully say, are pretty much running. We might be running a little slower, but we're running. So that's what we're doing.
Yeah, and I love that transparency of, and I know Virginia, you just shared that looking at the self-care and stress management for both providers and our community members. As we're sharing these resources, so often we come from that space within this movement of like, we're immune to, or we're not connected to, or we're not feeling those same. And it's like, y'all are seeing my house. We're all seeing each other's homes and connecting in a very different way, and all very definitely impacted by this. So not only how are we sharing resources for community members on those stress management and healthy boundaries, but how are we handling those ourselves? I think it's two-pronged there in terms of also recognizing our own stressors and challenges. So great. Other folks wanting to share some of what they're doing?
Yeah, I can
you
share.
Hear me? Oh, okay, go ahead.
No, you're good. Go ahead.
Hi, everyone. Good morning. Can you all hear me? I was trying to fix the. Okay, I see headline. Okay. So I'm from Haven Hills in the San Fernando Valley area as well. We have a 45-day crisis shelter. We have up to 18 months transitional shelter for domestic violence, and we also have an outreach program and a prevention program as well. So it has been a little hard to adjust to everything, but what we've been doing, if this can be of any help, so we've been all setting up phone numbers where clients can call each one of us that are working remotely directly for any kind of support. The reason is because we do understand that, especially right now that they're at home with their kids, sometimes they have to, kids are napping, and so maybe the group schedule that we used to have before, it might not be the same group schedule that we can still provide to the client as of right now. So what we're trying to do is we're calling all of them, and a lot of us have done it already. We call all of them and we set up we have a Zoom account, but we also have a GoToMeeting account, which is HIPAA compliant. And the reason because we still want to provide those group settings for the clients that are able to make it, and actually provide even more group for whoever has the little ones that are maybe sleeping and napping, so we can accommodate that time frame for whoever has a different schedule. We're also, what I'm going to start offering as well for whoever the clients that we have at the shelter and also at outreach, to kind of create two different team groups where also the teams are able to log in and kind of have a group, and they can all see each other if they want to through GoToMeetings, because it's very similar to Zoom. It's just less advanced, let's put it this way. But it's very user friendly. And for the resources, we gather up a lot of resources for the clients. So for whoever has access to any kind of computer, so we send it through email or we text it to them, and for whoever unfortunately has a harder time reading, we call them and we let them know what the resources are, where they can go find it. So we're kind of trying to accommodate as much as possible. It is still a process, but we're kind of trying to adjust. We are right now we have one staff member at the time at the shelter, and then there is another staff member at the same time from home receiving hotline calls as well. So we're kind of trying to everybody, whoever is working from home is supporting who's working on site, and whoever is working on site is kind of trying to support all the clients over there. So it's kind of it's an adjustment, but that's what we're trying to do. And definitely on our social media, there is always updates on self-care, also things that the children can do at home, and if they have access to tablets or TV, they can what channels they can watch, or what that are educational as well. So we're kind of trying to gather resources as we go and send it to them, but checking in with clients almost on a daily basis, everybody. So we're doing case management 101. We're still doing, what do you call it? We're still doing intakes, but everything is going to be through GoToMeetings or over the phone, depending on what they have access to.
I love it. Oh my goodness. We're having conversations here. I love seeing this prevention and intervention working together. This is so cool. I love that. So I'm jotting down some questions because I know there are folks who were ready to share. So Sheridan and then Holly. Sheridan.
Yeah, so I can just share from our standpoint in terms of social media. We kind of ground ourselves in our 10 signs of a healthy relationship, 10 signs of an unhealthy relationship, which those 10 signs stay consistent, but we're really working on developing different examples of each in this time when, you know, relationships stay the same, but the situation around them is very different. So how do you maintain a healthy relationship in a time of social distancing? How do you recognize behaviors that may be unhealthy in a totally new circumstance? So, you know, as you said, a lot of people are living all together, close quarters, there are going to be conflicts, but like, how do you resolve that again in a healthy way? And also, how do you know, recognize unhealthy behaviors even in a distance relationship? How do you recognize somebody who is still attempting to isolate you from people, or who is still a little bit too intense in the way that they're interacting with you? So we're doing like short Instagram stories. We're posting things on all of our different channels and whatnot to kind of demonstrate some of these healthy and unhealthy signs. And yeah.
I love that. So this is one love. Okay. On the flip side of that, also wanted to hear if, as folks are, or as we hear from Holly as well and other ideas, what about teens and their relationships, right? So this would be a time when teens are in school. And imagine, put yourself in the position of a 13, 14-year-old, and you look forward to seeing your partner at school Monday through Friday, and then all of a sudden they take that away from you, and you can no longer see this person that you are in love with and, you know, just love to see at school. What happens to you? How are you managing that stress when you can't see them and you want to go see them? And sometimes it's hard to understand, like, why do I have to get locked up? Why can't I go out? So just some questions for folks as we're working with teens and their relationships, because we know it's a very real crisis for them. Thanks, Sheridan. Holly.
Hello.
Oh, sorry, Holly. Well, I have a
Do you mind if we have Holly go, Jen?
Okay.
Holly's been waiting. Yeah, Holly's been waiting for a little bit to share, if you don't mind. Thank you. And then you're next. Jen is next.
Cool. So hello. I think there are a couple close to home people on here, but I'm an adult team organizer for the Close to Home program. And our team has really gone full swing into, because they're all working from home now. Some of them are out of work. So they're like really diving into wanting to volunteer more, even remotely. So the social media thing we're focusing on right now is highlighting local stories. So we're trying to do like a little mini series of different topics. So right now our topic is the service industry. So we have one of our volunteers for the past week has been interviewing, I think he's interviewed like 9 local business owners, bar owners, restaurant owners, and also the staff to hear their stories of how this is impacting them. And then we're working on editing the videos down right now to post them. And then following that, we want to do a kind of resource share via social media for people who are in that situation. So like service workers whose work has been cut down or are completely out of work right now, what's available to them. And then another post of what individual community members can do to help out. So whether that's like patronize the restaurants that are still open, or like start some kind of like donation fund, or like anything that an individual can do to help get that out there. So the one we're focusing right now is service industry. And then once that one's wrapped up, we want to do survivorship during COVID, so like highlighting how isolation is obviously a lot more difficult for people in abusive situations. And hopefully the team's hoping to interview like some of our advocate staff, but also maybe someone from CBEDV, someone from CalCASA, and then put out a bunch of resources for people in that situation. Yeah, that's what we're working on right now.
Love it.
That's awesome.
I have a lot of questions. I have questions, but I know I asked Jen to hold off a little bit. So let's let Jen share.
Hi, thank you. So I have a youth mentor group, and I also have a 12-year-old in my house, and Zoom has been awesome for both groups. As far as my younger one, she talks with her friends in group chats just like this on Zoom, and her school has given out iPads to all their students and have done so for a few years now, and they went ahead and added a Zoom app to it. And so she is feeling like she's not cut off from the world. And my youth mentors had an upcoming their high school students event to work with a local elementary school, and that was canceled. And so I was tasked with trying to find other ways that they could work together and help their community. And again, I used Zoom to have a meeting with them to discuss a launch of our Instagram page, and have them come up with ideas that they can show their point of view and perspective of what's going on right now. And we'll post things about activities that they're doing to keep busy and to keep calm and mindful during this really stressful time, because most of my high schoolers are seniors, and they're really upset about missing prom and missing walking across the stage. And so using tools like this online has been a real boon to how they're feeling and being able to communicate and see what others are going through.
That's a great point. Graduation. We don't know when we're going to be back. We don't know how this is going to impact folks. I know there's conversations. A couple of you had said superintendents and principals are having conversations about what's going to happen with graduation. And what about if this is your senior year? As much as we complain about, put yourself back in that position. You're a senior and you're getting ready to graduate, and it's like your last semester, and everything gets canceled.
Mm-hmm. Yeah, I've been talking with some of the youth in my life and that they're connected to, and some of their friends, and talking about that kind of mourning period of like they're not getting to do homecoming, they're not getting to do prom, and like being able to create some space for that, just as we are having to mourn some of the activities that folks have put a lot of work into, like as you're planning Sexual Assault Awareness Month and how different that's going to look this year versus previous years. I just wanted to highlight, I know folks were having a really great conversation, and I want to know that the chat is safe. So there's been a lot of really great resources that have been shared, and people talking about some of the social media campaigns that they're doing, and some really fantastic resources. And so we're going to be compiling all of those and being able to share that out to everybody as soon as the webinar is over. So any resources you want to share, please do so. If it's links, if you've got, I shared a PDF of something that we had used when I worked with youth in the shelter. Just keep all of that information coming, and your social media pages. We would love to be able to share that out to everybody, and to be able to have that connection for folks as well as we keep moving.
Yeah, so Jessica, thank you for your question. Are you providing any recommendations on making adaptations? I know we're all different in what we're looking for, and I know for some, definitely, you know, I'm one of them. I love hearing what is working in one place and how I can use that and adapt it for my situation. So for example, the stress reduction, I think I had shared before, one of the projects I'm working on is strengthening economic supports. And, you know, one of our main goals was to get out there and do some regional trainings addressing how to access paid leave. We were going to do this community of practice that was going to get together and learn on paid family leave training toolkit, and that's not happening. So how to adjust? So right now I'm looking at the stress reduction. I'm thinking, ooh, I need to develop a fact sheet or some social media posts that address financial stress, right? We know what financial stress does to relationships. We know that it is a risk factor. So I'm going to have to adjust and probably work on sharing some information on stress management, financial stress, and also working on getting folks access to information that are impacting everybody. So we have a webinar today at 1 that's addressing do I qualify for unemployment? Where do I go to apply? If I am not fluent in English, I normally would go with one of the community-based organizations to have my application filled out. Those are closed. Where do I go? So working with some of the community-based organizations to provide some online support to help folks fill out their applications. So for me, I think there's times when this helps, the sharing, the exchange of information to come up with other ideas of what adaptations to make. I don't think Miranda and I had a plan to say, you know, if you're working with boys and men and now you're not going to be able to go into schools, this is what we think you should do. I think we wanted to hear from you all because that's being culturally responsive. It's let's hear about ideas and see how we can adapt what we're doing. But if you're wanting something specific, Jessica, please let us know. And if others are wanting something specific right now, also please let us know so that we can work on that. Any specific needs, specific recommendations, let's put that in the chat, or you know, just wave and we can call on you so you can share.
And Gabby with Marjorie Mason Center had a great question. What are folks doing with the younger kids, particularly middle schoolers, that do not have phones, or for youth who don't have cell phones? How are you reaching them? How is your prevention program still connecting, or what are some strategies you're considering?
I can kind of speak on that. This isn't really like a broad solution, but our youth volunteers, we met via FaceTime last week, and then one of our volunteers doesn't have an iPhone, so we're just switching to Google Hangouts, but you can call in through a phone number. So even though one of our youth doesn't have constant internet access right now, they can still do that. So that doesn't solve the problem of not having a phone, but at least if they don't, they can still call in through Google Hangouts.
I know Zoom has some limitations. Yeah, we're connecting via Zoom. I was just going to say, Zoom is definitely, you know, involved right now. They're developing a lot of products to help folks out. So yeah, check that out. I think the free one has a limit of 10 people that you can have. Yeah.
I'm just pulling up their page right now because I actually had them up because I know a lot of folks have been using Zoom. So here's their pricing for folks. So that definitely, they have some variety. And I would, yeah, so that's one of the platforms, and I know that I have received a lot of requests from folks on how to use Zoom and what some of the functionality is on it. So we are going to be doing a webinar, sorry for my dog if you can hear her. We are going to be doing a webinar next week, but I can also, I'll just let you know if you and your team want to join on a individual Zoom to just kind of go through the functionality, then that can absolutely be an option too. And we'll get the registration information out ASAP to folks for that. It's not the only platform, but it is, especially with having the free feature. I know a lot of folks have been using that.
Mm-hmm. So this is a cost that can definitely be justified, right? If you're not going to be able to meet with people and you had funding allocated for an event or to meet somewhere, this is, for me, this is an easy justification, is now we need Zoom because we need to meet with folks online.
Yeah.
This is Janine, and I know that a lot of teachers have been able to get the fees waived. So it might be helpful to just contact Zoom. I'm sure they have a lot of programs out there right now for nonprofits and other organizations and schools and teachers. Even if you're working with a specific teacher at your school, see if there's a way you can get in through there. But I think right now they're pretty open to waiving fees for those that just can't afford it or want more than the allocated amount of time that you would get for the free, the non-subscription service.
Mm-hmm.
What about, so I have a couple of questions in terms of what is coming up for folks and adaptations. So one of them is, many of us, right, we're focused on reaching a specific group. So if that was boys and men, girls and women, sports, how are you adapting your program currently, or what adaptations are you making to continue reaching these groups? And then to give folks a moment to kind of think about that, just, I know we have some managers, some leadership in the room. How are you showing up for prevention? So what is that looking like at your organization? So if you are a member of the leadership of your organization, how are you showing up for prevention? I'd love to hear from managers and directors who are present today. So, but first, if we can continue on culturally specific groups. So if you were going to be working with a specific group, how are you making some adaptations to reach those folks? And we can go group by group if you want. I know we have some that shared they were wanting to reach boys and men. So we can start there. If you were focused on reaching boys and men, what adaptations are you making right now? What is that looking like?
I'll say something. We were approached by our local alcohol and drug recovery center a couple months ago for our advocate to go and do a men's sexual assault support group. And instead, now what they're trying to do is upgrade their equipment so that they can do Zoom with their clients and do a private discussion.
Okay, thank you. Oh, is Jonathan getting ready to share? Love it.
Thank you. So for us, actually, we've been fortunate enough that like most of the young men that I reach are high school students. Sorry if I'm facing one way because I have two screens and this one's got the camera and that one's got the videos. We're fortunate enough that everything's being done through Zoom now. And I'm still able to communicate with the principals or the teachers, and they were able to send out the teachers were able to send out messages to the students to let them know that that our regular sessions are going to still continue going on through Zoom. The only thing that I'm seeing now is because we're also doing Zoom for the other youth groups that we've started. The only thing that I'm seeing right now is that for the Zoom accounts, they're usually in order to have the free account, usually there's a time limit on it of 30 to 40 minutes, and that's I don't think that's enough time to especially when we're all trying to talk about in a transitional period. So but as of what I've seen so far, like I'm still able to keep up with my regular classes through Zoom. It's just been shortened down. Now I will have to try to see how I can change my curriculum because it's not as participatory anymore without being all in one room. But yeah, that's how we're able to continue forward with our classes.
This is Caroline. I just wanted to add that I think that Zoom might be lifting the 40-minute time period for certain groups like educators or just in general. I mean, I've been on some Zoom calls with like socially with friends and we're not using any like paid account and they've been lifting the 40-minute time limit on all of them. So that's definitely something you could reach out to Zoom about just to make sure when you're planning your class and things like that.
Thanks, Jonathan.
Yeah, and I just know with Zoom, some folks have been experiencing some delays because of the, like with their free accounts, the capacity was not prepared for our shift. And I know that what we've heard from them is that they are really working to increase their access so that there isn't that lag for folks.
Any others want to share? How are you adapting your efforts to reach boys and men? I know some of you mentioned the meeting from yesterday from a call to men. Anything you want to share here on how you're making those adaptations?
I guess I'll go. Except I'm coming from a little bit different of a standpoint. Like being said earlier, this is I think my third week doing this type of work and being in a position with CBIM. So a big part of, I know we're really focusing on our outreach right now and figuring out what ways we can ensure that we get our outreach out. But with that being said, because we haven't really implemented coaching boys into men within Ventura County yet, if I were to reach out, it'd be starting it right from the start. So there's something that was already implemented. So everything would, essentially have to be online. So I think we're still kind of working how we want to go along with that in terms of teaching coaches, and especially with, having it be coach-led, how do our coaches then interact with the students and so on and so forth. So I think that's kind of the position that we're at right now with the interface.
Thank you.
I am not sure if this can be of any help, but one of my roommates, he works for Children's Institute, and he works for Project Fatherhood. So for when it comes to his group, they've been able to actually already run groups through Zoom. So
Okay.
So all they do is, they reach out to all the parents, all the fathers and male in the community that they've been providing groups for. So for what I know, he has already provided like 2 groups this week. What they're asking mostly is for obviously for whoever has the means to obtain some kind of headset. Just because it's in the house, to make sure that there is the confidentiality respected for other people that are sharing throughout the call. But he has been able to do that through Zoom, to do groups.
Awesome, thank you.
You're welcome.
Well, this is Scott from Center for Nonviolent Community. I just wanted to share a little more about the call yesterday with the call to men. Okay, hear me okay?
Yes, perfect.
All right. Well, one of the key points I thought was good to share with you all is that, a call to men, they're, premise of the man box. So during this time of crisis, we have an opportunity to reach out to the men and boys in our lives, in our community, and really encourage them to share about their fears and, you know, have them be open to ask for help when they need it, because, you know, boys are not socialized to do that. And then, let's see, what was that? And then, you know, Ted Bunch just wanted to really emphasize it's, in our positions, this is a great opportunity for us to listen with our hearts. And, you know, I think that will help everyone that we have in contact with.
Yeah, thank you so much for that, Scott.
Thank you. What about reaching, so listening to what you're saying, and I know some of you were working on sports. So are you connecting with the community partners, the trusted adults, the coaches, the staff? What is that looking like for you all?
Hi, this is Peniel from Center for Nonviolent Community. I actually work as a human resource coordinator for Center for Nonviolent Community, but I'm also a coach of our local high school volleyball team. And I know that we have had a couple of programs initiated where we can send out like mass emails and all of that. So we've been using those platforms. And I have personally felt and have been working with my team, my coaching team, of finding programs to keep kids active. Because I think that's the other thing that's really unfortunate right now is that many kids, the only time they're not sedentary is when they're out of the house. And so getting them at home, really, they don't realize how much it impacts their mental and emotional health. So just sending activities and things like that out to encourage them to do something at home, work on their skill sets that apply to all of their, you know, specific sports. And I know that I've been working with some youth and young adults and just talking to them about dreaming, because this is the right now and this is their moment, but giving them like a platform to like start looking at their dreams, like where do they want to be when they step out of this. So
as a coach, do you have any recommendations for folks who, you know, we're working with coaches? How can you reach out? What are some ideas for those who were planning on working with coaches?
Currently, I know, like, because my sport is volleyball, and so I know that we have a lot of different platforms out there that are also reaching out and providing their services for free. So I would suggest to coaches and all of that out there to go and find the different platforms that maybe weren't available to them or they would have to pay for in the past, and really look to see what's available right now. Because I think that that's the beauty of that like that field, is that they really see the youth that are involved and realize the impact that this has. And you know, so they're trying to provide as many resources as possible. Something I would want to like present or question, and I know like when I was working with our prevention team at CNBC, is like, are there boundaries that we should still be holding up if in our process of reaching out to youth through our own personal accounts to get them activated and involved and all that? I mean, have people, like, what kind of standards should we be setting up for one another in this? Anyone?
And I think that that's a really great question that we are having to work through. Sheridan, it looked like you were starting to unmute.
Yep. Yeah, I was just going to say we have had that conversation a lot too, because we have a really large youth volunteer base who are really engaged in their schools, whether that's college or high school, and they want to stay involved and be involved. But we just kind of have a system that we've had for a while, but are like developing it to be even more like virtually conscious of like, if we're starting like a youth conversation series on Mondays and Thursdays, where we're applying like a lens to popular media about how to analyze relationships and relationship behaviors. We require that we have 2 staff, 2 adult staff or more on those calls that we're facilitating with youth. So still that like 2 staffers rule, as well as on emails that go out to like our youth volunteer basis. We have either a manager or an executive director or just another adult staff member CC'd on all of those. And then just, you know, being as transparent as possible, and also, you know, feeling justified in setting those boundaries with youth. Like if somebody, you know, can I text you, or can we talk about this, you know, in private, or can we do this? It's like in this time, even though it is like different circumstances, we are trying to be really, really intentional about, you know, having our bases covered as well, and just making sure that you can feel safe and that those boundaries are in place.
Can I say something?
Of course.
I just want to take a moment to like say that we should still be conscious that for youth, because our youth groups are still going on for Zoom, right? And they've already expressed to me, it seems like, I mean, adults are in a state of anxiety right now, and in the U.S. And I mean, we often forget that so are the young men and women, and it seems like, just from speaking with them, that everyone's trying to be helpful, but instead it seems like everyone is trying to could also be like overly working at it by like overcompensating for the fact that you're not able to be there necessarily for them. Like our youth has explained that the teachers, you know, since they're not able to meet with them in person, they're like giving them piles of homework, and they're like extremely overwhelmed. And yeah, and then here we are as well as we're also still trying to do our thing, and we're like, yo, we want you to like participate and do more things because you have freedom right now. But the reality might be that they might have less freedom than they did before. Mm-hmm. So just wanted to bring that up. And I think the question of boundaries is a very interesting question because I mean, it can feel like I've heard some of my coworkers already explain that they feel that now that they're working from homes, that the boundaries have been crossed, and like they're basically being reached from at any time frame for work when they weren't before. So I think it's an interesting structure right now. We'll see where it leads to in the future. Yeah. But there should be still, I think, in my opinion, still some boundary too. So
yeah, I think absolutely. I know some of what we've been doing with the partnership is we are 100% telecommuting now, of course, just like most folks, is having, like, we set up a Zoom phone so that we're not having to use our personal phones anymore in terms of as we're receiving calls, that's all being routed. And we can go in and actually set our work times and making sure that like we're holding each other accountable in terms of how we're maintaining that because like we typically don't have our laptops and, you know, my 2 monitors and my sit stand station in my home. But it's having to think about how are we maintaining those boundaries for ourselves, and how are we holding our workplaces accountable to acknowledging those boundaries, and like what is our actual work time versus, hey, I know you're home, like we all are. It doesn't mean I'm available 24/7. So how can we hold ourselves accountable to that? And also as you're being available to the youth and to your community, how are you also communicating those boundaries to them? And being able to hear what they need from you. I have a lot of kids in my life, and the piles of homework are kind of horrifying. One class alone was 150 pages that print it all out and do all these worksheets. I'm like, you just panicked and dumped a bunch of stuff, didn't you? And then that's the reality that a lot of youth are facing right now. Some have moved to the e-learning and others are trying to set that up. So it's just kind of being mindful of that, not only for our communities, but also for ourselves.
Yeah, and,
well, and I think that's also, sorry, go ahead, Jonathan.
Oh, and with what she said for 150 pages a week, I mean, that's what I'm doing in grad school. They shouldn't be doing that in high school, you know. But it's also, they don't have the schools don't necessarily have a set structure of like what to be doing or like what to be using. Like for my school, we use Canvas. Everyone used Canvas, but like for the high schools, the students that told me when we had the meeting yesterday, is like every teacher is using different platforms, and they have to check like multiple different links like Canvas and these other ones too, because it doesn't seem like the school system has a set system yet. So it's gotta be really like complicated, and you know, just kind of like being pulled from multiple different angles. And while you know, everyone else here is, you know, well, maybe not you guys, or like adults are like concerned about like, you know, how they're gonna get the next meal. We're forgetting that, you know, they're also concerned about those things. That we're also expecting them to do more than we are with homework and different, like in an unstructured like school environment, you know.
Yeah, I think with us, I think the question, I think Alejandra, you posed the question, like how are we showing up for prevention in terms of, you know, director positions or whatever. I think for me, what's been most important is to show up for my team. I think the transition happened so quickly. It was really, we came to work on Friday the 13th, which is funny in a lot of ways. But we came to work on Friday the 13th, and by like, I think not even noon, we were like, okay, everyone's working from home. And so it's kind of like a scramble of, we're working from home. Like it's not something we generally do. Like we do in-person work, right? And so really kind of like, crap, what does that mean? Like we have to get everything together. Everyone started, you know, what do I need to take home? It was just a little bit chaotic, right? And so, and then last week was our first week working from home. And I think for all of us really, after kind of like, what do you call it? The urgency and the chaoticness of it kind of wore off a little bit. And then it was kind of like, okay, wait, this is the real reality. So like, what does this mean, right? And for individually, what does that mean for our mental health to be working from home, right? And, you know, for RTS, it was really important to kind of be there for each other and kind of say, like, what do we each need? What do we each need so that we can do this in a way that's going to be helpful, not just for us, but for our community. And so like I have check-ins every day with my team, right? And sometimes we talk about work, and sometimes we just kind of talk about stuff that's going on. And so that's been helpful in a lot of ways to kind of stay connected with folks, because we were a very interactive group. We rely on each other to we talk to each other, we check in with each other all the time at the office. And so kind of missing that part of it has been hard for a lot of us. And then a lot of what we come up against has been, you know, some folks have talked about some of their schools have provided like iPads for their students, and that's, you know, all these great things, and that's amazing. And just acknowledging that not everyone has the same access, and how a lot of these online virtual services don't translate to Spanish, and also in other languages, I'm sure. And then just the cultural aspect of it, right? So we have counseling clients where we're doing online teletherapy, and some of our Spanish speaking clients were like, I'm not talking to a computer. Like, that's not something I'm going to do. I'm not comfortable with that. And so really thinking of like, how do we keep that in mind? Because we want to continue to do the group. The work, we want to continue to engage our community, but how do we also do it in a way that's not going to cause more stress, right? We have like our adult folks who are home and now their kids are home. So they're like, I don't have a private place to sit and have my, you know, counseling session, or, you know, we all share one phone, or, you know, or having to have them download this app to do the teletherapy. They're like, oh yeah, sure. And then, you know, they don't answer our calls anymore. So, so we're really trying to figure out how do we do it without adding more stress, because it's such a stressful time for everybody right now. You know, we have folks who are worried about paying the rent, although there's this whole, you know, idea right now that, you know, California's did an emergency till May 31st. No one has to worry about it. Like, you know, folks can't evict anybody. But there's a real kind of like, the fear is still there, and also the feeling of responsibility. So I had someone say to me, I don't want my landlord to think I don't want to pay, right? And I explained them to her, and I said, like, this is kind of what's going on. And so, you know, blah, blah, blah. And she was like, but I still want to be able to pay my rent. I don't want my landlord to think that I'm taking advantage of it. And so there's this real basic life needs that folks are really focused on. So that's kind of, we're still continuing the conversation. How do we continue to do the work and offer the work without causing more stress and adding more stress to folks? So it's kind of like figuring that out and being able to balance that. So we haven't been able to, as a lot of folks are doing really great work, which is amazing, but we haven't really been able to kind of jump into that part of it just yet, because there's a lot of things that we hadn't thought of. And the schools, I'm volunteering to help some schools with teachers translating to parents as they're checking in with them. And a lot of schools aren't set up for that either. And they're like, we don't, like, some parents don't have internet. So where do I send their email? Like, right? And so kind of like in this place of like, this is making my job hard. And I'm like, oh, yeah, okay. And like, so it's just a lot of things to think about. So we're still kind of working through, in terms of prevention, we are, you know, exploring how to, like, a YouTube page and putting things on video, and then how to create stuff on in a live, like Zoom or whatever that means. We're going to be reaching out to the schools, a lot of the schools, especially schools that we had planned already some RPEs around at a postponer council. We're going to be reaching out to them and saying like, hey, we're here, we want to engage, how can we do it? Because we also don't want to add more stress to the schools, because I know a lot of schools are like really kind of figuring out how to do this too. So I think it's been a little bit slower for us, just because we're trying to figure out how to do this in the best way that is not causing more stress. So it's been a little bit tough to do that.
Thank you, Cindy. I really appreciate that. And in the chat, you know, there's conversations about, yes, supporting staff, the importance of social connectedness. So I was also asking for the managers and directors, because a couple of folks reached out and shared, you know, that on Friday the 13th, there were these staff meetings of like, this is what we're going to do and this is what's going to happen. And it was very intervention focused, right? The counseling team's going to do this, the shelter team's going to do that. And what about prevention, right? That there were all these staff meetings and preventionists felt invisible, right? That they were left out of the conversation, that they weren't acknowledged. So just a reminder for folks in leadership, you know, let's continue this conversation about how do we show up, how do we make sure that we acknowledge prevention and get creative. So again, right, there are a couple of you who spoke about working with the advocates that are in shelter and engaging conversations around prevention, putting up messages. The other thing I was thinking about that, Jess, thank you for reminding me, media advocacy. So I don't know if you all saw, it's on our social media. I've been working with Univision, and we need to reach folks in a way that is accessible. So I've been talking about financial stress. You know, Univision and I are doing this. We're doing the Zoom meetings, or I record myself on my phone and then send it to them. But also for teachers, right? So you can contact your local news, radio, newspaper, work with them on, you know what, kids are being overwhelmed with homework. So this is your opportunity as a trusted adult also to show up and share that kids are dealing with a lot of stress. You're now at home. What if you're in a home that's not the most supportive, and you're having to do homework and you've got all your siblings? I was the oldest of 4. I would not be able to do my homework. I had to look after my 3 siblings. So let's think of ideas in which we could use the media around us to advocate, show up on the news, you know, talk to adults about how can you help the children or the kids in your home manage their stress. Just I think thinking outside of our usual platforms at this time would be great. I can't believe it's 11:55.
I know.
I could go on and on for another 2 hours with you all. So I do have a question, because I know we're supposed to meet on these PPN webinars, right, once a month. And we're kind of in a state of, we are in a state of a crisis right now. And Would it be helpful for us to meet with you all again sooner? And it can be, for whoever is interested. So are we thinking next week? Are we thinking in 2 weeks? Like, what would be helpful for folks? If you wouldn't mind just typing it into the chat, or if you are only on your phone, if you wouldn't mind just unmuting and saying, would you want to meet like every week, every other week? What would be helpful for folks? Okay. Like a 1 hour check-in. How are we doing? What's happening? Okay. Also, what else? So what did we miss? We spoke very, broadly today. What else would be helpful for you all so that we can work on? I know one of the questions I had is, have you reached out to funders? Are you getting the response you need from funders? How can we advocate? So we've got Virginia on here from Futures, also working with CDC. I'm also working with CDC, and CDPH is on here. I don't know if our CalCasa folks were able to show up, but I know they also, yes, they also are here to talk about that. So yeah, what needs do you have so that we can work on it in the next week and get back to you all with what else is missing?
Yeah, and I'll be reaching out to Cal OES as well, because I know we have a lot of Cal OES funded folks too.
I love it. One other topic I had is ergonomic spaces at home. Mm-hmm. So Melissa, our administrative director, sent out an email yesterday. What is that looking like at home for you guys? Are you needing a different chair, a different desk? Managers and directors, are you showing up for staff, asking them, what do you need to be able to work from home? There's also I'll send it out to everybody, Miranda. If we can't afford to buy all those chairs and stuff, and Amazon's also taking 6 weeks to deliver right now. So putting pillows under your bum to lift you up so that your spine is not being hurt. Lifting your screen, make sure it's right across from you. So making some adaptations at home to take care of you. Heating pads, ice packs, necks and shoulders. Yes. Yes, we got to take care of ourselves. Thank you. How do we get people in the room? Yes, so effective strategies. Using an ironing board to create a raised desk.
Like it.
That's awesome. I had never thought about that.
Also, those calendar alerts are beautiful for get up and move. Because I found I was dismissing them over and over, and I was like, why do I hurt? Oh yeah, get up and move.
Mm-hmm.
Eat regularly.
Yeah, they're saying that we're spending more time sitting as we're all working from home, which is hurting our bodies. So as Miranda says, put some reminders on, put it on your phone, walk around. I love the memes of like, where am I going to go for spring break this year? The living room or the kitchen, right? Move around, get around. This is an opportunity for you. You don't have to sit in the same place every day. Today I'm going to work in the living room. Move around. I think it really helps us with our space. So how are folks feeling? Was this helpful?
Okay, awesome. So I see that ask for how do we move into virtual prevention, and we absolutely will be doing that. I see a lot of folks looking at every 2 weeks, others wanting every week. So we will definitely, Alejandra and I will connect and look at our options, and know that tomorrow we have our Prevention Peer Network call to be able to look at how are we adapting our work for cultural responsiveness, or how are we adapting our curricula to be culturally responsive. So I hope folks will be able to join us for that. And we definitely will be holding more kind of fireside chats, if you will, and looking at what strategies are working for folks. And it's always those, what are the successes, what are the challenges, and being able to learn from that. So I'm putting the registration form in the chat right now. With this, it's just through Zoom, so it's just your name and your email. And once you have registered, you don't ever have to register for the calls again. You can just attend. It's the same link every single month. And so I hope to see folks tomorrow, and we will be sending a lot of follow-up resources. If not by the end of today, then definitely tomorrow morning for everyone to be able to stay connected and looking at what's working. We also have our Prevention Peers Listserv. If you are not on it, please know that we can get you signed up. So that'll be that information will be in the link. If you attended Building Change Together in Los Angeles, I've already put you on it. You got the welcome email, hopefully. And looking forward to more opportunities to connect with everybody.
Stay safe and healthy, folks. I mean it with all my heart. I love you all. It just feels like we're working together. We're in this together. So thank you. Please reach out. Miranda and I are here to support you. Email, text, for me, email, text, and Zoom phone now too. So reach out. We're here for you. Take care of you. Stay healthy.
All right. Bye, everybody.
Bye.